Hi, this is Scott Shepard and I'm Ron Miller with Pursuit Physical Therapy, and this is going to be a big one. This is the big question. We're going to go over, can you return to golf after having lumbar fusion surgery? So this is a big boy. We're going to go over this a little bit today. So the first question right off the bat is going to be, if someone who's watching this video right now had a lumbar fusion and they love golf, can they return to golf?
Yeah, and the answer to that really is yes. Of course, you can return. It's all going to be dependent on the stages of healing. You've got to make sure you have full recovery, of course, and also the extent of the fusion, how many levels, different things like that. But you can definitely return if you've gotten rid of your pain from the surgery, and you're back to walking and moving more normal, and your surgeon has released you. You can definitely return to golf with or without some modifications.
I always like to shoot the bar high, so if Tiger Woods can return to golf after fusion, why can't our patients,
exactly.
Right? Or better yet, if Hulk Hogan had 2 artificial hips and he returned to wrestling, why can't my patients return, right?
Exactly. You can return. These guys can do it, you can do it too.
So
you're probably not swinging anywhere near as hard as they are.
Yeah. So the point is, yes, this is a specific one. It's going to vary case by case. Not everyone with a fusion is going to be able to return, but if you treat it appropriately and you get the proper care, there's no reason why you can't set a goal to return to golf from that. So the next question that I'm sure they have is, when can they return to golf? What are some examples after having a fusion surgery? When can someone expect to return to golf, or even try some putting or try chipping? Is there any timeline out there, or any timeline that you use?
Yeah, so I mean, the first timeline obviously is the healing of the initial surgery has to occur. So physicians may have you in a brace for a period of time. Obviously, you're not going to be playing golf while you're in that brace. Once you've been released from that brace, most physicians will have a timeline where they say, I want no lifting, no twisting, no bending, no activities for X number of weeks. Maybe it's 6 to 8 weeks after it, and after that point, you can start gradually returning to those activities. So the physician is going to release you for the activity. We'll always defer back to them because they did the surgery, they know the extent of it, they know the components, what they did. We're going to defer back to them for the release. But they're also going to need feedback from a professional, somebody who can evaluate you and say, well, here's where you are. Because if we just look at timelines only, we don't really know, because everyone heals at different timelines. Some people may be well advanced and ready to go at that minimal timeline. Some people, I would say, no way, it's going to take you a couple more months before you really even want to consider bending over and putting and chipping and swinging and things like that.
Yes, I've even worked with some physicians that even say no golf for like a year.
Yeah.
But they're just being really, really conservative and stuff like that. So the point is, yes, there's no fixed timeline. If everyone's just going to say, just wait a year, but we can address other things and other impairments to get you ready at 8 months, there's a right and wrong way to do it. But yes, there are individual timelines. It's not a general thing. It's a case per case basis. So based off of your fusion, your other impairments, we can design, after a thorough eval, of designing a specific timeline of when we expect you to get back to putting, chipping, driving, playing 9 holes, playing 18, that it's really individualized. There is no general guideline. It's based off of you and how you present. So the last question that I'm sure that they have is how? How can someone go about even wanting to get back to golf after having a fusion surgery? Is there any plans out there? What do we do and stuff like that? So how can someone take the next steps and get back to golf?
Well, first thing you do is you make sure that the person has achieved the basic movements that are required. So that comes in with the screening. Is do they have enough ability to move segments in their trunk to rotate appropriately, their shoulders, their hips? Are they mobile enough so they're not going to overload their lumbar spine that they just had fused? They need to make sure that they're able to create this motion efficiently. So you need to get evaluated by somebody who understands the golf swing, somebody who could even carry on a conversation with your teaching professional if you have a swing coach, and understand what they're looking for out of your swing, so you can be able to coordinate what you're going to be able to do after this surgery. What limitations are you going to have? Do you have to modify anything or change some things with your setup, your positions, so that you don't overload your lumbar spine when you first get back into golf. That requires thorough evaluation, and really the answer is it's all customized to the individual.
Sure.
There is no set program you can find on YouTube that will tell you to go back to, for you, because they don't know your swing or your body type and how your surgery went.
Yeah, I think you really said it too. This is something that you don't play around with. This isn't something that you just watch a YouTube video and try to get back to it. This is more serious stuff.
Yeah.
It's more of a complex case. And you said the word overload the low back. And that's an important thing. And there's two ways to kind of solve that. One, if your low back is fused now, we have to solve the problem to deload that back, to not overload a fused back. How do we do this? We maximize hip range of motion. We maximize thoracic rotation and strengthen those muscles around there to prevent overloading the low back, because you can't fix the fusion. You can't maximize, it's fused, it's fixed, it's not gonna move. But the key, one of the first key in resolving symptoms and getting back to golf is maximizing hip range of motion, maximizing thoracic or your mid-back range of motion to prevent overload. The second thing that you also said is swing modifications. If you watch Tiger Woods, he changed his follow through to deload the back. You can't keep overloading the back. So the second way, you may have to make some swing modifications. And this is where the experts come in. This is not a general, just let's hope to get back to golf. This is something that I highly recommend you either consult with us with our golf injury program and performance program, or you consult with someone else in order to get back. This is more of a complex case. You have to have a thorough evaluation, identify risk factors, maximize range of motion above and below the fusion, and really work on swing modifications to really get you back. But I've had patients that had lumbar fusions or naturally fused, and they've had return to golf.
Sure.
They follow our step-by-step approach. They can get back to golf symptom-free and still enjoy 18 holes. So if you've had a lumbar fusion and you're interested in golf, or you're having pain because of golf, or you're wanting to get back to golf and you're not playing yet, give us a call today at 407-494-8835. Golf is something that you can get back to. You just have to get the best care, get expert guidance, and design a specific customized plan to get back to where you want to be. Scott runs our golf injury and performance program. We will make sure that you're taken care of. If you have more questions about our treatment approach or what we do, you can visit us at pursuittherapy.com and click on the golf injury and performance program. So thanks for taking time out of your day today. I hope you guys got some questions answered, and let's get them back on that driving range swinging, gripping and ripping. Thank you very much for your time.